Adenosine is primarily indicated for treating stable narrow-complex supraventricular tachycardia, or SVT, in emergency settings. It restores normal sinus rhythm. Adenosine slows down conduction through the atrioventricular, or AV, node, interrupting re-entrant pathways associated with SVT. For adults, the initial dose is 6 mg rapid IV push over 1 to 2 seconds. If there is no response within 1 to 2 minutes, a second dose of 12 mg rapid IV push can be administered. If there is still no response after another 1 to 2 minutes, a third dose of 12 mg may be given. Ensure that the dose is followed by a rapid saline flush to help ensure administration into the circulation. For pediatric patients, the initial dose is 0.1 mg per kilogram IV, with a maximum of 6 mg. If there is no response within 1 to 2 minutes, a second dose of 0.2 mg per kilogram IV, with a maximum of 12 mg, can be administered. Use a similar rapid IV push and saline flush as with adults. Administer via a large bore IV, 18 to 20 gauge if possible, to minimize the risk of local irritation. Continuous monitoring of vital signs and cardiac rhythm is essential before, during, and after administration. Be prepared for transient side effects such as flushing, palpitations, or brief heart rhythm changes, which are usually self-resolving. Use with caution in patients with asthma due to the risk of bronchospasm. Consider potential drug interactions, especially with other medications that affect heart rate or atrioventricular conduction. Adenosine is contraindicated in patients with known hypersensitivity to adenosine, second or third degree AV block without a functioning pacemaker, sick sinus syndrome unless a pacemaker is present, and asthma or reactive airway disease. In conclusion, adenosine is a critical pharmacological agent for paramedics managing SVT. Proper dosing, administration, and monitoring practices ensure optimal patient safety and efficacy during emergency care.